Good morning, everyone. I'm Elizabeth Anderson Hoagland with Health Promotion of the Department for Public Health. It is my pleasure today to introduce Ellen Cartmell. She is the Program Manager for the Kentucky Tobacco Prevention and Cessation Program at the Department for Public Health. She's been there about 3 years. Before that, she was our communications specialist, and she has worked at Buffalo Trace District Health Department. She also has a lot of experience in other areas, including the Red Cross and working in Switzerland. So ask her about her cool experiences sometime. But today she is here to talk about secondhand smoke. So Ellen, I'll turn it over to you.
Thank you. What Elizabeth did not mention is that she is my boss. So I'm a little bit nervous to have her here. And I'm also nervous because I know you all just heard from the wonderful Dr. Ellen Hahn, and I am the other Ellen. I learned probably at least half of what I know from Ellen Hahn. So I feel very honored to be with you all today to talk about this issue. So for those of you all who have met me, you may know secondhand smoke is a big passion area for me. It's actually most of how I got my start in public health was working with my local smoke-free coalition in Maysville. So I'm really glad to have this opportunity and excited to chat with you all. So I'm going to start off by just telling you what we're going to talk about. I really want to get into the who, what, when, where, why of secondhand smoke today. Now, this is where I'm going to warn you that the first half of this presentation is a little bit depressing because we're talking about the where and the who is affected and why does it matter, how is it affected. How are they affected? But I promise you, if you stick in there with me, we're going to spend the second half talking about that bolded line, that how can we all help? What can we do? But we can't go much further if we don't talk about that first bullet point, which is, what is it? What is secondhand smoke? So I'm sure you all know that secondhand smoke is the cigarette smoke from someone else's smoking. Now, it can actually come from two places. It can come from the actual burning end of a cigarette. That might be in somebody's hand. It might be sitting in an ashtray waiting to be picked back up. But that is called side stream smoke. Now, there's also mainstream smoke, and mainstream smoke is the smoke that's exhaled by a person who is actually smoking. Side stream smoke, the first one, is just a tiny bit more dangerous because it's hotter, but neither of them are safe. So let's talk about why. Now, I already said that secondhand smoke is cigarette smoke. At this point, pretty much everybody knows smoking is bad for them, but I do want to get into some of the nitty-gritty on that. We know that there are over 7,000 chemical compounds in cigarette smoke, and at least 250 of them are known to be toxic, and about 70 are confirmed to cause cancer. So this is really a big issue that we need to figure out how to address. Now, as I said, you all probably already knew, I'm sure you already knew that smoking is bad for you, probably also knew that secondhand smoke is bad for you. And one of the reasons for that is because of this landmark report that was published in 1964 by the US Surgeon General. So we see a picture of him there with his report. That was the first time that we were really linking smoking cigarettes with dangerous health effects like lung cancer and heart disease. So 1964 is also when we saw peak smoking rates as a nation, and they have gone downhill since then in the past 60 years. So that is some good news. We'll have a little bit of good news spattered here and there. But even though we have made a lot of progress since the 60s in terms of smoking, tobacco use is still our #1 cause of preventable death and disease nationally, and Kentucky is still in the top 5 nationally for our smoking rate. So we still have a long way to go. Now, between 1964 and 2006, we had a whole bunch of research arise specifically on children and secondhand smoke exposure. So if you have interest in what I'm talking about today, if you really want to dig into that research, this document that was published in 2006 is available online, and you can find all of the research that we had in 2006 on the health consequences of involuntary exposure to tobacco smoke among children. But it's funny, my branch manager said something about how many slides I have for this presentation. And I wanted to say, like, it's because this 2006 report on children and secondhand smoke exposure is 727 pages long. So there's a lot to cover here. But the one big takeaway, the number one thing that I want you all to remember from this presentation is that there is no safe level of exposure to secondhand smoke. So again, this is our number one takeaway. If you're taking notes, write this one down. There's no safe level of exposure. Now, the other big takeaway that I want you to have is that there are things that we can do about this to prevent exposure to secondhand smoke. But again, that's the second half of the presentation. So when I say there's no safe level of exposure to secondhand smoke, what do I really mean? And this is where it starts to get a little bit depressing. It means that there were 20 million people in the United States who died in the 50 years after that 1964 report was published, and 2.5 million of them were non-smokers. So people who may never have actually touched a cigarette or lifted one to their lips, but still died from other people's smoking. Sometimes you will hear that those non-smokers referred to as passive smokers, because even though they weren't actively smoking, they were still exposed to all of the same toxins, breathing in the same toxins from the air, and passively smoking. So what that actually looks like as far as today is we're looking at an estimated 41,000 adults in the United States dying from breathing other people's smoke each year. And the majority of those, almost 34,000, are dying of heart disease. So this is where I warned you it's going to get a little depressing. It's going to get even worse, but we all need to be educated and reminded about why this is important. So I know you all are here to hear about Children's Health, the Children's Environmental Health Summit. So I'm not going to focus too much on these adult deaths. But let's talk about why this matters for kids. And the sad truth is that people are not uniformly being exposed to secondhand smoke in the United States. There are certain groups that are disproportionately affected. So those are primarily children, Black Americans, non-Hispanic Black Americans, and people who are living below the poverty line. And if you can see those first two, those leftmost columns, the 3 to 11 years and the 12 to 19 years, if you add those together, that's where the majority of exposure is happening. And I will note, this exposure obviously is not self-reported. We can't ask 3-year-olds whether they are breathing in secondhand smoke, but these are people who we have measured and we have seen that they have cotinine, which is the chemical that goes into your body when your body processes nicotine. So these are people who are saying, I'm not a smoker, but then they're measuring as having nicotine in their blood. So we know that they've been exposed to secondhand smoke. So what this looks like in Kentucky is about 1,000 deaths each year in Kentucky. So if you remember 2 slides ago, I said that we have 41,000 adults nationally dying. So 1,000 for our little state is a disproportionate number. And that is because of some of the statistics that we talked about on the previous slide, as well as some of the protections against secondhand smoke that we don't have as a state yet. And I know I've already thrown some really big numbers at you, 2.5 million non-smokers dying, 41,000 adults a year. So I do want to stop for a moment and encourage you all to think about one person. And since this is the Children's Environmental Health Summit, can make that person a child. I like to think about my neighbor, Maisie, who, when I first met her, she was a couple of months old, and now I think she's about 6. But you can think of any child in your life, since this is the Children's Environmental Health Summit. Now, I would like for us to go through the next couple of slides, zooming in on what breathing secondhand smoke means for that child. So the first thing that we can observe is before they even take their first breath of air, they may be being affected by those 250 plus toxins that we know are in cigarette smoke. Women who are exposed to secondhand smoke during pregnancy are 11% to 20% more likely to miscarry. Secondhand smoke, we know, affects women's fertility and fetal health. Women who are exposed to secondhand smoke during pregnancy are also more likely to have newborns with lower birth weight. So even while my friend Maisie was still in the womb, her mother's environment was shaping what her health was going to look like. Unfortunately, we also know that sudden infant death syndrome, or SIDS, is 4 times more common in babies who are exposed to secondhand smoke. SIDS is the sudden, unexplained, unexpected death of an infant in the first year of life, and it's the leading cause of death in otherwise healthy infants. And we know from research, from observing, that the chemicals in secondhand smoke are affecting infants' brains in ways that interfere with the regulation of breathing. And as a result, nationally, we have over 400 SIDS SIDS deaths each year nationally that are attributed to secondhand smoke. So it continues to be depressing. I'm sorry, I promise it's going to get better soon. But secondhand smoke is also responsible for lots of breathing problems in babies. We know that infants exposed to secondhand smoke are 50% more likely to be hospitalized with respiratory infections. And there was a study done a few years ago that estimated that secondhand smoke is responsible for as many as 300,000 lower respiratory infections in babies. And so that's bronchitis and pneumonia, 300,000 from secondhand smoke exposure nationally. We also have a lot of cases of asthma attacks. So kids who are exposed to secondhand smoke, obviously that irritates the lungs. So they are 66% more likely to seek emergency care and 85% more likely to be hospitalized than their peers who aren't exposed to secondhand smoke. We're going to talk about some of the sources of that secondhand smoke as we go on, but a lot of times it is somebody smoking in their home, like a parent, but not always. Sometimes it is also maybe where they work or being in school. So I have an example here of Jameson, and you may be thinking, what do you mean where they work? They're children. But actually we have a lot of children people who are under 18 who are in the workforce in Kentucky. So I wanted to show you this example of Jameson's story. This is a national campaign that was done, but Jameson actually lived in Lexington, Kentucky. So we have a hometown story right here. Let me know if you cannot hear this.
When I had my first asthma attack, I was terrified. To be honest, I was scared because I didn't know what was happening. I didn't know why I wasn't able to breathe. I didn't know anything. I was just known that I couldn't breathe. I was at work and somebody was smoking, and it just got to me.
I received a text message from Jameson. And the text message said, "Where are you?" And I said, "I'm at home." "Why?" And he said, "Well, I'm trying to get air." And I knew that that was not a good sign.
So I called my mother, and she came and got me and took me to the hospital.
And so I turned my flashers on, my emergency lights on, like it was a siren, I guess, because I was driving fast. And I just held his hand because it was very scary. And I just held his hand and I told him just squeeze it every now and then, just so I know that he's breathing. I didn't want him to talk because I wanted him to save as much breath as he could. Within a matter of minutes, they had him hooked up to an IV. They had the nebulizer hooked up, had him on a breathing treatment, continuous breathing treatments, and they were just doing everything they could to open up his lungs.
When I was in the hospital, I was there for about 3 to 4 days, and I wanted to go home, but then again, I didn't, because I knew in the hospital there was no smoking. And outside of the hospital, there was a lot of smoking, and I didn't want to have to go through that again.
Secondhand smoke exposure triggers my son's severe asthma attacks.
So I think that story is so powerful, especially when he talks about wanting to leave the hospital. As any of us who have had a hospital stay know, you want to get out of there. But he also didn't want to leave the hospital, and that is very sad. So we estimate, and this is a little bit of an older study, but there's an estimate that up to 1 million asthmatic children had their condition worsened by exposure to secondhand smoke every year in the United States. So we want to prevent as many of those complications as possible. So not everything is related to the lungs directly or to breathing issues when it comes to secondhand smoke. We also know that children who live with adults who smoke have much higher risk of developing a middle ear infection than kids whose houses are smoke-free. So if you think about whatever child you were picturing, I'm picturing Maisie, knowing that she's much more likely to go through that pain if there were a smoker in her home is very sad. But it's, again, there are some surprising effects. It's not just looking at breathing issues and things that are related to the sinuses. Children who live, who are exposed to secondhand smoke have a 27% higher risk of tooth decay. They have a 14% higher risk of filling, and that is when adjusted for other factors like income and race. So this is pretty directly attributed just to secondhand smoke. They are also, children who are exposed to secondhand smoke are at a higher risk of glucose intolerance. So potentially looking at diabetes in the future. And again, that's adjusting for other factors. 40% higher when they're between 18 and 30 to have glucose intolerance. And secondhand smoke is also affecting children's cognition and learning. So my friend Maisie, if she lived with an adult who smoked, she would be much more likely to miss at least one day of school per year. So children who live with smokers typically miss a day to a day and a half more days of school than other children. She also would have 3 times higher odds of being diagnosed with ADHD, and that's triple the risk of children who are not exposed to secondhand smoke. Children whose mothers smoke have lower average IQs, and there has also been a link between secondhand smoke and issues with reading, math, and visual spatial reasoning. So looking at testing and looking at which children are testing positive for having that nicotine in their blood. Now I finally have some good news for you, but it's kind of brief. The good news is that exposure to secondhand smoke has dropped drastically nationally. So this is, again, those people ages 3 and older who are exposed to enough secondhand smoke for it to show up in their blood. Numbers are way down. We're going from 80%, high 80s in the 1980s to more like 25% today. But I have 2 pieces of bad news. The first is that, as you can see, progress has stalled. We are not making steps to improve this the way that we were before. And the other piece that is a little bit negative is that the progress has not been uniform. So some states are having a lot more success with this than others because of the policies that they've had, which we will get into. So now I want to talk about secondhand aerosol. So speaking of all of those trends that we're seeing, we all know that vaping is on the rise. And I want to make you aware of secondhand vape or vapor that is not vapor. So secondhand aerosol, just like secondhand smoke, you can imagine it's that cloud that is released into the air when an e-cigarette is used. As I just said, it is not vapor. So the industry, the e-cigarette industry, the tobacco industry, they want you to think that it's water vapor and that it's harmless. It is not. It is an aerosol, just like for a hairspray. So definitely not something that you want to breathe. The Surgeon General has recommended prohibiting vaping in enclosed areas to avoid probable harm because of secondhand smoke exposure. And the reason for that is because of all of these things that we know are in that aerosol. So there's nicotine, definitely. Many people think that there is less nicotine in their vape than there actually is. But research shows that 99% of vape products do contain nicotine, including ones that say 0% nicotine or nicotine free. So that labeling is not always reliable. There are other volatile organic compounds, heavy metals, known carcinogens, and things like diacetyl, which is linked to popcorn lung and other serious lung diseases. Now, the other thing that is in e-cigarette aerosol that makes it so dangerous is these ultra-fine particles. And when I say fine particles, I have a chart here or an image here that will show you the this is a human hair that we're looking at across the screen. You can see how teeny, teeny, tiny these particles are. So the ones that say PM10, dust and mold, obviously those are things that you can see floating around in the air. But we're talking about particles that are so small, they probably cannot be seen, but they can come deep into your lung tissue and worsen heart and lung disease and even lead to premature death. So there has been research to show that e-cigarette use does increase the number of fine particles in the surrounding room. So just like secondhand smoke, even if you are not the one who is actually using an e-cigarette, actually vaping, when you exhale that, all of those fine particles are in the surrounding room. And bad news, even though we have secondhand smoke exposure going down, we have secondhand aerosol exposure going up. And this is self-reported exposure, specifically among youth over the past, or over a 4-year period. So you can see a sharp increase in e-cigarette aerosol exposure. So I have one more thing that I need to talk to you about, which if you read the objectives, you know. We also need to talk about third-hand smoke. So third-hand smoke is the easiest way that I can think of to explain it, is what makes your clothes and your hair smell if you have been in a smoky area. So it's a residual contamination from tobacco smoke or e-cigarette aerosol that settles on physical things. So it can attach itself to dust in the air, it can attach itself to clothing, to skin, etc. Because when all of those particles from secondhand smoke or secondhand aerosol go up into the air, they have to come down somewhere and they will settle on things. Now, a lot of us, obviously, we think it's just an offensive smell, but where there's a smell, there's also that indicates the presence of those tobacco toxins. So unfortunately, the gases in secondhand smoke can be absorbed into carpets, draperies, other things like dust that I mentioned, and then they can be re-emitted back into the air and form known carcinogens. And those can stay in the environment at high levels long after smoking has stopped. So I have these 3 icons on the side because third-hand smoke exposure can happen through breathing, whether you're when inhaling that dust or inhaling those gases that have been re-emitted. It can also be absorbed through touch, through the skin, if you're touching furniture or clothing, anything that has third-hand smoke residue on it. And then it can also be absorbed through the mouth, through the tongue and the tissues in the mouth. If you are using things or putting things in your mouth that have third-hand smoke on them. So, as you may guess, this means that small children are especially vulnerable to third-hand smoke because, as you all know, as we can see in this picture, there is nothing children love to do more than put things in their mouth. Oftentimes, things that have been on the floor. So a lot of third-hand smoke residue does accumulate on the floor where Maisie or other babies are learning to walk, taking their naps, playing with their toys. That's where a lot of those particles end up, and then they go into baby's mouth or are just inhaled from the dust on the floor. And because of this, we know that infants consume twice as much third-hand smoke dust and other dust as adults. So that is my last depressing slide. Yes. So now we get to talk about what we're actually able to do about this. Good news, finally. So I have been able to come up with 5 proven solutions that we can do to address children's exposure to secondhand smoke. And I'm going to get into each of these individually, but I want to take a moment to talk about how 3 of these, the first 3 that we're talking about, are policies. And the reason that these are important is because when you're able to pass or implement a policy, you can change the environment that people are in without needing to go do individual education from person to person. So it's a way to make broader changes over a shorter period of time. And I'm going to talk about what that looks like right here. So proven solution number 1, we've got those people at the table. That is comprehensive smoke-free ordinances. So a comprehensive smoke-free ordinance is one that prohibits smoking inside of all workplaces and all indoor public places. This is what I call a big P policy. I shouldn't say what I call, it's a known It's a known thing. I did not make up that term, but it's a big P policy because it requires elected officials, at least in Kentucky, to pass it for you. So this means that your state representatives or your county commission, your fiscal court, your city commission, those elected leaders need to pass this law for you in order to make it happen. Now, there are probably some of you who are thinking like, of course you can't smoke in workplaces. Like, what are you talking about? This isn't something that we can actually do because it's already been done. To which I would say, you probably you definitely don't live in the community where I'm from, because there are actually lots of places in the United States and lots of places in Kentucky where smoking is still allowed in workplaces. So this map shows us the states that do have smoke-free laws. The green is comprehensive law. So that is a law that, again, covers all workplaces and all indoor public places. Blue is a strong law, but it maybe doesn't cover everything. They might have an exception for something like bars or music venues or something similar. And then gray means there are no restrictions or just local level restrictions. And unfortunately, as you can see, Kentucky is in the gray. So this is one of the things that is contributing to the fact that of the 41,000 adult deaths nationally, Kentucky has 1,000 of them. We have a disproportionate number. The good news, however, is that support for a statewide comprehensive smoke-free law in Kentucky is really high, and it just gets higher every year. So the Kentucky Health Issues poll asked this question: would you favor or oppose a state law that would prohibit smoking in public places, including workplaces, offices, restaurants, and bars? And we have 74% of adults who are asked agreeing with that, which I challenge you to find anything else in public health that has 74% support. So this is really, really exciting. And it would be great to see Kentucky go smoke-free as a state because of the health implications that would have for everyone. However, that has not happened yet. And therefore only 36.7% of Kentuckians are protected from secondhand smoke in workplaces at this time. And that is because the cities that you see and the counties that you see on this map have had a fiscal court or a city commission or a city council pass that ordinance for them to say, within our limits, we're not going to allow smoking in workplaces and in indoor public places. So I also have how that looks here. We have 41 comprehensive smoke-free municipalities in Kentucky, starting back to 2005. Now, I will say, if you are from Lexington, you might be saying, what the heck? We were the first ones to do this, and we did this in 2004. And you are correct. You are correct, Lexington. However, Lexington's ordinance was originally just covering indoor public places and not indoor workplaces. And it was a couple of years before they strengthened that to add indoor workplaces. So this timeline that we have with the dates, this is for policies that include both. So the difference between the two would be there are workplaces that are not open to the public, and those are not included if you have an ordinance that only includes indoor public places and not indoor workplaces. So an example might be like a private club where you have to be a member to get in, but then they still have employees inside, whether that's somebody who cleans the property or a bartender on site. We need to have ordinances that cover workplaces in order to protect those people from secondhand smoke. And of those 41 municipalities that I just showed you, 35 of them include e-cigarettes. And as you can see, over time, we've had more and more of them, including e-cigarettes, in those policies from the start. So we thank them for that and thank them for recognizing the dangers of secondhand aerosol. So you might be thinking, Ellen, you're talking about workplaces. How do workplaces affect children? I hope that you remember the example of the video that we saw from Jameson, who was exposed to secondhand smoke at work as a 16-year-old. But this is also affecting babies and infants too. So in Kentucky specifically, research has shown that babies are less likely to be born preterm if their parents live in a comprehensively smoke-free county. So my friend Maisie, if our county were smoke-free, she would have been 9% less likely to be born preterm. She also would be 23% less likely to become a smoker in the future. So this is really exciting data that just came from the University of Kentucky and from Ellen Hahn, the last speaker, and some of her colleagues there who are able to show that if students are raised in counties where they don't see smoking in workplaces, they are less likely to use cigarettes and also smokeless tobacco. And then in Lexington specifically, when they went smoke-free, they saw an 18% drop in emergency department visits for childhood asthma attacks. So my friend Maisie would be less likely to end up in the hospital, less likely to become a smoker, less likely to have preterm birth, all of these benefits if our county were smoke-free. And it's also, of course, affecting her parents. So this is actually a picture of Maisie that I took a couple of years ago. I love this picture of her, and I just think it's so sweet. But her mom needs a smoke-free workplace. And unfortunately, according to 2018 data, 19% of Kentucky adults are still saying they're exposed to secondhand smoke at work, and 11% are still being exposed in other public places. So we don't have this data specifically for Kentucky children, but we can see an indication here by looking at adults of what that might look like. Additionally, if you're working in a smoky place, you are definitely bringing third-hand smoke back into your home where children are going to be exposed. So unfortunately, much like secondhand smoke exposure generally, this is not uniformly affecting everyone. It is primarily affecting our youngest workers, 18 to 34, Hispanic workers, people who make less than $50,000 a year. And you can see that huge jump. A lot of people who have less than a high school education. These are the people who are most likely to have jobs where they are exposed to secondhand smoke at work, maybe because they're working in the service industry or another industry that's less likely to be protected. And they're also, they may know about the dangers of secondhand smoke. I'm sure they don't want to be exposed to it any more than the rest of us do, but they may have fewer options or feel that they have fewer options in terms of saying, this is a deal breaker for me, I'm going to find a new job. So this is very serious. You can see almost 40% of people with less than a high school education saying they have to breathe these toxins when they're in the workplace. And I do just have one more slide that talks about how this is affecting adults. So adults who live in a comprehensive smoke-free community in Kentucky are 22% less likely to be hospitalized with COPD, and they are almost 8% less likely to be diagnosed with lung cancer. This is huge because Kentucky has the country's highest rate of lung cancer by a fair bit. We are working on that very hard. And this is a proven method to drop that rate by an estimated 8% if every community were to do this. So all of these things are going to affect children as well, not only because they grow up to be adults who may have COPD or lung cancer, but also because it affects who's raising them, the health of who's raising them, the stability in their household. All of this is vital to their emotional and mental well-being. So that was solution one, smoke-free workplaces in as many communities as possible. Our next proven solution is 100% tobacco-free schools. So we do not want children, when they are going somewhere where they are trying to learn, where they need to learn, being exposed to known carcinogens, known cancer-causing chemicals and toxins. So a 100% tobacco-free school policy prohibits the use of tobacco products by students, staff, visitors at all times on all school-owned properties, which is why that logo says everybody, all the time, everywhere. We are not going to use tobacco products here. This is another big P policy because historically it has needed to be passed by the school board, and those are elected representatives in the community. So in my mind, if you have an elected person making the decision, that makes it a big P policy. We're going to get into what a little P policy is next, but big P policy. It's also a big P policy because in a few years ago, our state legislature passed a law saying that Kentucky school districts had only a certain amount of time where before they needed to either opt in or opt out. or specifically to opt out. So that made a huge difference when the legislature passed this law. We went from having, there are 173 school districts in the state. We had 72% of them were smoke-free right after this policy passed. And a year later, that had more than doubled. So we are now up to today, having at least 169 of the 173 school districts in the state are smoke-free, are 100% tobacco-free school districts. So we are so excited about that. The image that I have here on the left is showing some students marking off their school district a few years ago when it was added. Now I don't know how to access the chat box, but I will say, does anybody know what is out of date about this map of Kentucky that I have? Let's see what happens if I click the chat box. Okay. No. I'm so sorry if you all have been seeing that gray bar the whole time. Not county, exactly. Perfect. And I know exactly why. Sorry, I see that this message just went to hosts and panelists, so I'm the only one who can see it. But Sherry Stidham of Kentucky River District Health Department jumped in, put it in the chat. Not county is white on this map, but it should be blue because their school board just voted for them to go 100% tobacco free. And they did that over the summer with much support and help from Sherry Stidham in Kentucky River District Health Department. So I'm so glad that she's tuned in and that she caught that. So we are not finished though, even though we have most of the school districts in the state being tobacco free. We also need to work on enforcement of that. Any policy is only as good as it is, only as strong and effective as it is enforced. So I have an example here, two messages that have been used to help promote smoke-free environments. One, I love this from Boone County. They put up on their football field board, just says, Boone County High School reminds you that smoking and vaping are prohibited. Little things like this can make a big difference in reminding particularly visitors and parents who might be at a game that this is a 100% tobacco-free environment. We also have these students from children from Mason County with this I deserve a smoke-free future sign, which I love because every Kentucky child does deserve a smoke-free future. So that was solution number 2. So 1, we had smoke-free workplaces. 2, we have smoke-free schools, 100% tobacco-free schools. And now let's look into the example of Little P policy that I talked about. So for Little P policy, we have smoke-free multi-unit housing. So in an ideal world, building owners or managers set smoke-free rules to protect residents from secondhand smoke traveling between units. So this is a Little P policy because it's not something that typically an elected official would do. It's more something that, again, the building owner or the building manager, somebody who has authority but maybe isn't an elected person, is making this rule that can improve the environment for everybody who is affected. So this is important because secondhand smoke is insidious. It can travel anywhere. If there is somebody in the building who is smoking, everybody who shares that ventilation system is also being exposed to the secondhand smoke, which is why I really like this graphic from New York, actually, that says your apartment can't be smoke-free if your building isn't. So there's been some research done on this. Nationally, we know that from polls of multi-unit housing residents, so apartment building residents, most people say, yeah, I wish my building were smoke-free. We know that the majority of people are non-smokers and they don't want to breathe secondhand smoke in their home. But again, just saying you can't smoke in my apartment is not safe enough if there's a person in the apartment next to you or the apartment downstairs or the apartment upstairs, there are people smoking in there. Opening a window, running a fan, running an air conditioner, air purifier, those do not eliminate secondhand smoke. And that's true for workplaces as well. Sometimes we hear building owners or business owners say, well, what if I get one of those smoke eater fans and then you won't be able to smell it? It does reduce the smell sometimes, but it's not eliminating the toxins from the air because again, there's no safe level of exposure to secondhand smoke. So having smoke-free buildings is extremely important when we talk about apartments, condos, and other connected properties. Now, some people are already protected from secondhand smoke, specifically people who live in HUD, or Housing and Urban Development housing. So there is a rule that went into effect in 2018 that said you cannot smoke within 25 feet of those properties if it's a HUD property. And that is protecting thousands, hundreds of thousands. I want to say it was like an estimated 700,000 youth living in HUD properties nationally who are now protected from secondhand smoke in places where that's being enforced. However, unfortunately, there is sort of a loophole in this law, this rule that Housing and Urban Development made does not apply to Section 8 properties. So it only applies to HUD-owned properties and not ones that receive HUD credits for housing low-income people. So there are still millions of children who live in HUD subsidized housing, but not HUD owned housing, that are exposed to secondhand smoke. So the more that we can make sure that this is being addressed, the more that we can protect people from one another's secondhand smoke, the better off these children are going to be, avoiding those asthma attacks, the future heart disease, the dental cavities, all of those things that we talked about at the beginning of the presentation. So those were our three solutions that are policy driven. So we had the 2 big P policies passed by elected officials, and the one little p policy, which was this one, when a building owner says, no, you're not going to be able to smoke in this apartment building. Now we can get into individual decisions that Kentuckians can make to help. So proven solution number 4 of 5 is people choosing to make their personal homes and their personal vehicles smoke-free, because everyone deserves a healthy home and deserves not to breathe those toxins. So the good news is that in 2018, 76% of Kentucky adults did not allow smoking in their home, which is excellent. However, 15% of them still said that they were exposed to secondhand smoke in their home. So I do want to emphasize, and I'm going to emphasize, that there's no safe level of secondhand smoke, but even if you can take that outside or take that in a separate room from a child, it does make a difference. So here I have represented the effects of, or the risk of being hospitalized for infants whose mothers smoke. So compared to infants whose mothers smoke in a separate room, infants whose mothers smoke in the same room are 56% more likely to be hospitalized. Infants whose mothers smoke while they're holding them are 73% more likely to be hospitalized. And infants whose mothers smoke while they feed them are 95% greater risk of being hospitalized. Again, this is just compared to infants whose mothers smoke in a separate room. So I absolutely at all times want to emphasize the importance of having 100% completely smoke-free homes. But if that's not possible, at least getting it as far from the children as possible in another room is an improvement. However, there is no safe level of exposure to secondhand smoke. Remember, this is your number 1 takeaway from this presentation. No safe level of exposure. So if you can take it outside or quit altogether, that is the best solution for your children and your family. Now, I also want to talk about secondhand smoke in vehicles, because there are studies that show that cigarettes and cars are a particularly bad combination. So even when you crack a window in the vehicle or the fan is on, secondhand smoke concentrations in cars can be far more than other places, including like a smoky bar. So I have been in a car with a smoker where they're like, oh, well, I'm just going to crack the window. And I'm like, no, please don't. That's not good enough. We can pull over, we can take a break, but please don't smoke in here, because it just makes the toxins all spin around and they're still remaining in the car and still creating third-hand smoke in those environments. So the good news is 71% of Kentucky adults do not allow smoking in their vehicle. However, 18% reported exposure in a vehicle in the past week. So this is still a problem that needs to be addressed. And you will see that 71%, that is fewer than people who wouldn't allow smoking in their houses. So that's interesting that there are more adults who said, yes, you can smoke in my in my car than there are who said, yes, you can smoke in my house. Again, much like the workplaces, this is not uniform across all Kentuckians. The younger you are, the lower your income is, and the lower your level of education, the more likely you are to be okay with there being smoking in your vehicle. Now, we're going to talk more about that in a second, because here are my recommendations for smoke-free cars and smoke-free vehicles. One, please institute rules for your visitors, for your guests, for the people who live in your home, saying, we're not going to smoke in here. Recommendation number 2 is ask about smoke-free policies before you rent, and also ask about past smoking in the property before you buy, and then also avoid properties that have been used by smokers in the past. However, all of these, especially number 2 and number 3, are a lot easier if you have a higher income. So going back to this slide that talks about the income and the education level, I am sure that those people know that cigarette smoke is bad. This is not a question of their intelligence. It's probably a question of what they can afford and what they are able to offer. These are people who may be with the lower income. They may be carpooling with others, and they really need maybe that gas money that they contribute. So it's harder for them to say, no, you absolutely cannot smoke in here. So all of this is steeped in those disparities. A lot of these solutions are not equally available to everyone, and I do want to make sure that we acknowledge that. So I have a couple of ideas about removing third-hand smoke. Anything that you can put in the washing machine is going to help get rid of those toxins, and you can remove them from hard surfaces like countertops or plates with an acidic solution such as vinegar. However, when you're talking about walls, which are mostly hard but a little bit porous, and things like insulation, HVAC systems, etc., it is virtually impossible to get all of the third-hand smoke out of those, which is why it's so important that we avoid renting spaces where smokers have lived in the past. So, now let's say that you are ready to do a smoke-free policy for your home. You're ready to say, please don't smoke in here anymore. I really want to emphasize the importance of being polite and compassionate. Think about how you would like to be treated if you were the smoker. We're not going to embarrass them. We're not going to shame them. We are just going to let them know that this is not something that you allow in your home or in your business or whatever it may be. So be firm. And don't apologize. It's okay to just say, oh, smoking's not allowed in here. Can you please take that outside? Or like, I'm sure you didn't know this, but we don't smoke in here. So we'll wait for you if you want to finish that outside. But there's no sorry involved. There's no apology, because you are protecting your family and yourself and your health. Just remember, it's not about the smoker. It's about the smoke. So we are not using this as a reflection of their character. We are just making this about us and how that smoke, regardless of its source, is affecting you and what we're going to do about it. So I have another tip on making your spaces smoke-free. If you've previously permitted smoking, get rid of the ashtrays, maybe put a sign on your door, have your family sign a smoke-free pledge, put that on your fridge, anything you can do to kind of make it obvious from the start that like, oh, we don't do that here. And if you've had a visitor in the past, like maybe your mother-in-law or someone else who has smoked and you have allowed that in the past, you may want to let them know in advance. And it can be easy breezy. It should not be confrontational. Arguing isn't going to get you anywhere. So I use this example of, oh, we are so excited to see you Saturday. By the way, I wanted to let you know we've decided not to smoke in the house anymore. I really appreciate your help. Is there anything that I can serve? Like, I'm thinking about making potato salad. How does that sound? Just drop it in there so that they're not embarrassed in the moment. Hopefully it prevents you from having to have that conversation with them once they've already lit up, and then you have to say, oh, no, you've made a mistake, which that intervention is always worth saying in the ways that we discussed on the previous slide, but it can help to let them know in advance. So we are now here on our very last proven solution, and that is just eliminating smoking and vaping. If people quit smoking, then there is no secondhand smoke to endanger children and to endanger you and other people in the community. So this is going to be a personal choice for each person who uses tobacco products. They are going to need to do it when they're ready, but there may be things that help inspire them, like their kids asking them to quit, or if you're able to share information like, I don't know if you know this, but Maisie is more likely to start smoking because she sees you smoking, and being able to do that in a non-shameful way, and you have to have that relationship there. But people who perceive their kids' health to be affected by their secondhand smoke are much more motivated to quit. So sometimes people are not ready to quit just for themselves, but they are for their loved ones. And also to give you some more confidence in having those conversations, almost 9 in 10 Kentucky adults who smoke say that they want to quit. So they may not be ready to say it to you because maybe they're afraid of shame or something else, but the research shows that they do want to quit and they just need support and they need help. So the support that my program has to offer is that 1-800-QUIT-NOW, the quit line, which you may have heard of, Quit Now Kentucky. So there are lots of resources available through this to help people get the help that they need. It's completely free. It's completely confidential. You can call any time of day and they will give you free coaching and also often give you free or help connect you to free nicotine replacement therapy. So that would be like Nicorette or patches or gum. So this can be a major factor, like I said, in preventing kids from ever becoming smokers in the future, especially if you quit while your child is young. And if your child does start smoking, maybe when they're a teen, they're more likely to quit if their parents have quit while they were still very young, before 3rd grade. So you will thank you for more moments like these. This is one of our ads for Quit Now Kentucky. So with that, these are some resources that I would like to leave you with, and I am happy to answer any questions with our moderator, Elizabeth. Oh, wait, I will just say one more thing, which is that this picture is also Maisie. And so that shows you how long I've been working on Smoke Free. I told you she's 6. And this is the first Smoke Free campaign that we worked on together, where she said, I said I deserve a smoke free future for her. And she drew on that. And it is just one of my favorite pictures of all time. Thank you.
That was wonderful, Ellen. I do see a couple of questions in the chat. One is, what kind of enforcement is there for smoke-free policies for, let's say there's a restaurant where they're allowing smoking when they're not supposed to, or if it's like a multi-unit housing or HUD housing, how is that enforced?
Sure. So I will admit I'm less familiar with enforcement for HUD, but I do know that for an ideal ordinance, a model ordinance for workplaces like a restaurant, is that the restaurant would be the one to bear a fine. Typically that comes from an inspection by the health inspector. So the health inspector from your local health department is already in that space, making sure there aren't pests, making sure that your meat is stored at a proper temperature, etc. If they observe smoking or observe ashtrays or something, that can be part of their report. And each county is going to differ, or each municipality is going to differ. It might be a warning the first time, a $50 fee the next time. Oftentimes those escalate, but it usually is not something that reflects directly on the person who is smoking, because it's the responsibility of the business owner to ensure compliance with all of the municipal laws. Now with HUD, I know that was crafted really carefully to ensure that smoking in your home does not result in eviction or homelessness or anything like that. But working with the people to make sure that they have access to quitting resources, that they're aware of the policy, and that is collaborative. But if you're interested in housing policies, I'd be happy to look into how those are enforced and get back to you.
I have another question. Does the Quit Now Kentucky help emphasize the difference between using nicotine replacement therapy as opposed to people who try switching to an e-cigarette to quit?
Definitely. And I should mention, if you are using e-cigarettes, you can call Quit Now Kentucky to help with that. But Quit Now Kentucky definitely only emphasizes nicotine solutions that are FDA approved. So there are, I think, 7 things that you can use that have been approved by the FDA, from lozenges to nicotine inhalers. Those are not e-cigarettes, and the Quit line will help you talk through that and help you understand that and give you something that is has a much lower risk of damaging your lungs and damaging your body than an e-cigarette does.
One last question. Popular conversation about e-cigarettes calls it vaping, and that there's vapor being emitted, but it's not actually vapor. Is there some kind of movement to make sure that that aerosol is identified correctly?
Oh, that's a great question. We in public health, we in my program try very hard to always identify it as aerosol and not as vapor. There is education going around about that. I know that there was somebody from Shawnee Christian, I've forgotten exactly what it's called, but it's a community health center, and she would have like a little spray thing of hairspray and then a squirt bottle of water and be like, which of these seems more like e-cigarette? And oh, if you really think like it's fine, why don't I spray this hairspray on your hand, and you can see like how sticky it is. Now imagine that in your lungs. So there is a lot of education that's going on there. There has also been some mass media, some national media talking about how it's not harmless. However, I would say we have kind of given up on vaping and not using that term, because it's so much easier and so much easier for people to understand to say vaping than it is to say using e-cigarettes, especially with the advent of Juul. There were so many teens who were like, I don't vape, I Juul. And it's like, okay, so being able to use language that's accessible for everyone is really a challenge when the incorrect industry terms have become the most commonly used terms. Would you add anything to that, Elizabeth? Really, you're kind of the expert on a lot of this. You've been doing this longer than I have. That's why you're such a great boss. I'm not just
I was there during the rise of Juul, and I failed to prevent the rise of Juul. So maybe don't give me too much credit.
I would say we need your help. Whoever asked that question, we need your help getting the word out that it is not just vapor. It is an aerosol that is full of all kinds of things that are not safe to breathe.
Okay, that is the last of the questions that I see. And I know we have another session coming up in